Welcome, everybody. It's wonderful to see everybody at the first Saeed Awan Memorial Lecture. I'm Marianne Levitsky with the board of WHWB, and I'm going to turn it over to the president of Workplace Health Without Borders International, Jennifer Galvin.
Good day. Welcome, everyone. Welcome. This is an important day for us, and thanks to Susan and Mary for making this happen. And we'll introduce our guests. Our lecture today is a new venture for Workplace Health Without Borders. The WHWB mission statement underscores the principle that occupational health and safety is a basic human right. But in addition, it carries a particular concern for workers who are the most vulnerable and who have limited or no access to occupational health and occupational hygiene and health protection. The majority of these workers are in the informal economy and traditional trades, but they are by no means confined to the low income countries. They're also common in richer nations, often in the gig economy and short-term work. What is common among all these workers, unfortunately, is high occupational risk and low occupational oversight and protection. This special series of talks, the Saeed Awan lectures, will be drawing attention to the unsung heroes who have devoted their lives to providing occupational health services to these workers. It will be highlighting the challenges they face, but just as importantly, the innovations and successes that they have achieved in spite of these challenges. So our first lecture is about the life and work of Saeed Awan, presented by two members of his family, both working in the field of health. Miss Dua Awan, his daughter, is a fourth-year medical student in Pakistan, and she will present first. Dua, we invite you to share with us your personal experience of your father and what he was able to achieve. Miss Awan, please.
Hi, everyone. I'm Dua Awan, and today I'll be introducing my dad to you guys. So, first of all, I'll give an introduction of my dad, his background, and then his background, early life, and education. Then I'll tell you what led him to this path and how he became part of this field. And finally, a personal picture of my dad. So, who was Saeed Ahmed Wan? An inspiration and guidance for professionals today. But in addition to all of this, he was an amazing father, husband, and son to his family. He was born on 12 September 1962 in the humble village of Barapin, which is located here in Pakistan. And the word Barapin, it stands for big village in Urdu. He was raised in a household that struggled financially. And his father, he was a farmer and he just had a high school diploma. And his mom had no schooling at all. So his education, it began at government school Zafarwal, where his performance was really good and he earned top honors in his matriculation, that is high school exams. And to attend school, he would undertake a journey of 10 kilometers where he would go each day. He would travel on a bike there. And during his free time, he would assist his father in the fields. And his family, they also reared cattle. So his duty was to bring fodder and churn it and feed it to the animals. And he used to tell us stories of how they had no electricity in his village. And he had to study by using a lantern during the night. And he usually traveled to the woods near his place to avoid all sorts of distractions. And most people of his village, they disapproved of studying further. But he was lucky enough to have good teachers, and his family, they were pretty supportive and they encouraged him to go for higher education, and he was among the first ones in his village to study further than high school. So his for higher education in 1979, he went to Lahore and he did his FSc from there. He did FSc from Government Islamia College and then BSc in 1983 from Government Islamia College. Later for MSc, he joined the prestigious Government College Lahore here. Where there he specialized in chemistry. And in 1986, he managed to attain the first position in his MSc program that earned him the Distinguished University Gold Medal. And throughout his academic performance had been really good, so that also earned him the Chaudhry Muhammad Ali Gold Medal from the University of Punjab. After graduating college, he worked for a year at a pharmaceutical factory. So in 1988, the United Nations and the major world powers, they were focusing on the poor working conditions in developing countries, including Pakistan, and the government of Pakistan, they were facing pressure from the donor agencies to address the health, safety, and working environment concerns. So at that time, the Punjab Public Service Commission, they advertised a vacancy for the position of environmental hygienist in grade 18. And my dad, he recognized this opportunity and he decided to apply for it, and he was fortunate enough to be selected for it. In his role as an environmental hygienist, my dad, he provided training, information, and advisory services in various areas of environment, safety, and health. And the British Council, they recognized his capabilities, so they offered him a scholarship to pursue an MSc in Occupational Hygiene from the University of Manchester in 1993. And while he was there, he tried to use as little of his scholarship money so that he could save it up and he would send it back home to his family. In 1996, my dad was appointed as the acting director of Center for the Improvement of Working Conditions and Environment, and later on, he was permanently placed on the seat. After his appointment as the director of CIWC, he used to visit different industrial zones in various cities of Pakistan, and he was extremely worried when he visited the poor working atmosphere in different industries, in brick kilns and tanneries in the province of Punjab. The workers there, they weren't educated about the safety hazards in the fields, and since he himself came from a struggling background, he understood their conditions and their struggles. So he took it upon himself to improve the working atmosphere and making sure that all the workers there, they were educated on taking care of their safety and health while working in such an environment. And he conducted many small courses in the CIWC, also in other cities, to generate awareness among the factory owners and the workers. Keeping in view his interest and his marvelous work, the UNO and other donor agencies, they invited him to different workshops and seminars in various countries where he got excellent opportunities to learn in the field of health, safety, and environment. My father, he wanted a secure and healthy working environment in all the industries and workplaces. And he wanted that all safety measures should be followed so that when a worker here is injured, his whole life is affected. His children, their family, they depend on his earnings. So as a result, the children, they are sent to earn instead of going to school. And so many cases of child labor, they rise due to this reason. So my father, he was really concerned about this, and he was really against child labor. He wanted to make sure that it was completely eliminated from Pakistan. He wanted safety to be the biggest concern in all working environments. If someone did get injured, their family should be taken care of. Sadly, no one has been able to achieve this in Pakistan. We hear of so many workplace accidents every day, but we never hear news of what became of their families. One of his goals was to make schools for the children of the workers and laborers And he did manage to make a few schools for the children of brick kiln workers. They were provided free education there. And I honestly believe that this was his greatest achievement of all. His own journey of pursuing education despite the challenges in his village and family's financial struggle, they likely fueled his efforts to provide education to children who lacked access to it. Because of his background, he understood the conditions and struggles of the laborers, and this likely made him highly relatable and approachable within his community. One of his primary goals was to ensure that the safety and health of the workers in industries including agriculture, livestock, cotton picking, pesticide spraying. He aimed to identify the workplace hazards to the workers, and he developed strategies to prevent injuries and illnesses among the workers. He wanted to create a safer, supportive, and healthier work environment for the laborers and their family. He wanted to ensure that the workers, especially those from the disadvantaged background, they should receive fair treatment, protection, and opportunities for personal and economic growth. To summarize, my dad's goals, they were centered around creating a safer and supportive working environment for the laborers and their family, and with a particular focus on eliminating the child labor. And he wanted education to be the main source of empowerment. One of the challenges he faced was getting a budget from the government of Punjab. His practical initiatives, they demonstrated that it was possible to achieve the workplace improvement in local industries, but it could not be expanded due to financial constraints. So he started efforts to get a share in the budget from the government of Punjab, but in spite of his efforts, year after year, as such, it was never a priority, and budget allocations, they remained low. But he didn't lose heart, and he continued his efforts with true dedication and spirit until they bore fruit. My father, he used several methods to improve health and safety. Through his research and writings, he examined the nature and the causes of the health and safety problems that the workers were facing in occupational sectors, and raised awareness about the dangers to workers' health and safety in various industries, as well as issues related to child labor. He produced brochures and booklets in Urdu, which use graphics and illustrations to help the workers with low literacy skills to understand the dangers. Academics and officials, he wrote books, articles, and web materials to provide laws and policies that would support the occupational health and safety. He conducted many workshops too, where the workers, they were taught about the basics of health and safety. One of his most important legacies is technological improvement in traditional tools and machineries. One example is the fodder chopper, which is a traditional machine which was causing serious injuries and amputations. So he designed a safer version of it. Also designed a carpet weaving loom for the workers, which made it no longer possible for the children to use, and it also increased the productivity of the workers. And this invention, it led to him being awarded the Tech Award for Innovation by the Tech Museum in 2005 in USA. He was also awarded the prestigious Tamga Imtiaz, which is a really high civilian honor here in Pakistan, for the contribution towards his field. The personal side of my dad is that he was really dedicated to his work. He used to work overtime, but he always managed to make time for us. The first thing he always did whenever he got home from work was he would take me and my siblings out to the park next to our home. No matter how tired he was, he always made sure to spend time with us. He was consistent in approach of achieving his goals. Sometimes he would even go to his office on his days off because he was worried that his work would be lacking. And he was a really keen learner. He learned to skate with us, and he was always teaching us various words from different languages. His colleagues, they remember his ambition for team and organization. He used to listen to them patiently for solutions, and he was always encouraging them to express their ideas. All of his friends and colleagues, they speak highly of him. He used to maintain optimism in all kinds of stressful situations. He was really optimistic. Even when he was sick, he was so optimistic. He would never let us worry about him. He was always trying to cheer us up. He didn't even want to get treatment because of the cost. He was afraid that we would be left helpless in case the treatment didn't work. But it was his dedication and hard work that came through for us. The government gave support to us after his death, all because he had given best to his field. Moreover, so many people, they've helped us out in so many situations, all because my dad had been there for them when they needed him. I'm really proud to call Saeed Awan my father. Thank you so much for listening.
Thank you so much. That was excellent. I know you have lots of questions, but please hold your questions to the end. So next I want to introduce Dr. Alvi.
Welcome everyone who is here to listen. I'll just continue what Dua has said in a wonderful talk, though there are some sound-related issues, but I will try to be close to the mic this time. So challenges and barriers in promoting occupational health and safety, and I will start from the challenges, the basics which every developing countries or lower sources countries have. But also in the developing countries, there are, of course, challenges related to the advancements, particularly in the era of artificial intelligence and so on. So it's an honor, I think, to speak at this forum today. And the idea is not only to acknowledge the extraordinary efforts of a remarkable individual, but also to inspire and motivate OSH advocates to carry forward the legacy, particularly in low-resource countries. So it is, I think, so important to have an improvised approach. And particularly for the low cost and effective solutions to improve the workplace safety while conforming with the environment and cultural demands. A safe environment is the right of all, not just for physical, but also for mental well-being. Ultimate goal is global uniformity, I think, without violating cultural and social norms of the society. So important for me, I think. Knowledge and will are the key determinants. And that's what I think. The basics remains the same. Data collection, analysis of the data, and producing evidence for an effective change. Need to empower workers by educating them about their rights, as this makes the initial step towards ensuring safety in the workplace. So I will quickly review the challenges and barriers, particularly for the low resource countries. I think a lack of knowledge and training to apply principles of safety leads to noticeable as well as unnoticed disasters. Noticeable when it is noticed by the media and get attention, and most of the times unnoticeable because of the listless behavior of the community sometimes. Because of multiple factors, I'll just not go into detail. And I think the learning from past experience, training, and addressing chronic occupation-related ailments that often go unnoticed are all essential components of a comprehensive safety strategy. Hazards such as respiratory issues and chemical exposures in industries like dyeing, tanneries, and construction industries, they continue to affect workers who are often remain unregistered and unrecognized. And I think we need to question. We need to question ourselves. We need to question the government, the educational institutions, and the industries for their role in promoting occupational safety. And a significant portion of the workers or the workforce operate in the informal sector. And I'm sure most of the occupational safety and health workers, they know the Keith Hart, who in 1970s, early 70s, first used this term for lower source countries. But it's surprisingly, I was just going into detail, it's growing even in the developed countries these days, particularly when the people are working at home, and there are so many other things in unregistered. online works and so on. So they have their own impact at a different environment. So they at a different economic domain, of course it is. So it involves low-paid, compromised, and exploited individuals, particularly from migrants. I was looking into the informal sectors of the developed countries. So it goes on and on and on in different shapes at different times. So what is important? The data, I think, and the poor access of the informal sector. And there is no control and implementation of safety standards in this sector, particularly in low resource countries. Even the minimum required standards are not met. And above it, the children working in hazardous environment carry further challenge. And local community need to be involved to bridge the gap. That is important. And that was the work which Saeed did so amazingly. So these are the few pictures just showed. This is all from the Saeed's work, where just to show that how the children work beyond their capacity and exposed to all kinds of hazards. And in short term, injuries and long-term disabilities, and one important disability is, of course, illiteracy. Illiteracy remains one of the disability for the children who keeps on working at the tender age, early age. And resource constraints, of course, they do play. Poor resources translate into inadequate implementation of safety measures and difficulty in hiring skilled professionals. However, I think will and motivation transcends many limitations. And Saeed work is an open example. That's what need to be seen by what we are here for, to lead to the examples he set. So compromising workplace safety under economic pressure without minimal standards actually means neglecting basic human rights. That was first introduced, the human rights. It's so important. So, of course, there are limitations in terms of enforcing capacity. There are budget constraints, lack of personnel, trained personnel, and recognition of the safety is all important. But at the end, it is the right of workers which matters. And can't apply similar standards and approach in different environments and cultures. So we have to modify. It's so important. It's so important to understand. Don't push, just understand before you apply anything, particularly if you go to the low resource countries in different cultures. And I think an improvised approach to apply safety standards, making low-cost engineering solutions, and evidence-based and data-driven approach is required, with an emphasis on high-risk sectors and vulnerable workforce. That includes, of course, child labor and bonded labor. Collaboration among all stakeholders and involving workers is the key, and it has to be a continuous cycle of improvement. And how to improve in a cycle, I strongly believe in audit loop, where you audit your structure, your process, and that automatically improves the outcome. And that is the key. You have to define the minimum standards, and it is the loop to improve. Identify the risk, collect the data, compare with some standards, whether national or international, whatever you set, make change and review. And after making the change, if still the outcomes don't improve, then the system or the structure or the process has to be accountable. And that is actual is governance, what we call governance. So what are the key issues, such as informal sector challenges, the lack of data and evidence, and the importance of knowledge and will. And it is pivotal to make a real impact. Protecting the rights of children and the most vulnerable among us is a moral obligation as well. So how it got better? So this is an insight from Pakistan and how an extraordinary effort led to all these changes, which started in 1988 when Saeed embraced the challenge, and through his phenomenal work, achieved remarkable results while collaborating internationally, especially with organizations like International Labour Organization. Innovative solutions and adaptations led to remarkable achievements. His work consistently prioritized the most vulnerable, especially children and the young. It is an example of motivated will and effective resource utilization. And this is Saeed Awan. Dua has already shown some of her pictures, but these are the awards he got from renowned national as well as international areas, and what he was able to achieve. So research and data, that was the first thing, and that remains the basics. And his contributions are far-reaching and multifaceted. It was a colossal work. Not possible to reflect in 20 minutes, of course, but I will try to throw some light on the approach which Saeed was using to advance his work, to improve the ergonomics, modifications, low-cost engineering solutions, and of course, focusing children and the bonded labor, that the more vulnerable. So just to start, I think when I went through all the work he did, his start was with the cross-sectional studies. He did a quick cross-section study to understand what is the situation, like in Punjab, in the district, in different districts. He made a cross-section study and he generated comprehensive data. And that evidence he produced that helped to generate low-cost solutions with a focus on more hazardous and vulnerable sectors, all led to huge impact, not only improving the safety standards, but also reducing child labor and improving awareness. And that was the key. So the research and data, I will just give some examples. One example is the hazard assessment of children working in 12 sectors in different districts. So he focused after cross-section studies that which district has the more vulnerable sector in which more children are working. And one example is this 12 sector studies, where he identified that the children working in auto workshops in one district, while mining and quarries in other districts, barber shops, steel fabrications, steel hawkers, and roadside sellers, and so on. So he managed to gather all this data and managed to identify the children in a particular sector in a more vulnerable areas in a different districts. So, and again, this is from one of his work. How he managed to collect data. He assessed the hazards involving and identifying health and psychological issues, the process which are involved in the hazards, and he took the samples and take the psychological health in mind as well. And apart from physical ailments, it helped to reveal so important for children, the feeling of hopelessness, helplessness, and fear among children, which are employed in different sectors in different districts. So risk and risk reduction, that was one of the key and important objectives. And preventing vulnerable and reducing risk become easier once the data and evidence is at hand. And then you act on the findings. So this is again one example. He used to make movies, and they come back to the office after making movies, take a detailed assessments of each and every step. This is one example in date orchards, where the dangers and prevention of workers he managed to identify and then educated accordingly, like climbing and then sliding down the fruits and having toxins used to process the dates, the chemical drugs, they contain formaldehyde, washing of them, and then putting them in hot water and to make them more palatable and softer. So all in all, even how to take them in an area, and you can see that. So crossing small these crossings and then putting these into the sun. So all in all, everything was washed and then studied and then making adjustments accordingly. So then comes the ergonomics and mechanics and low-cost solutions to mitigate risk. So this is so important in his work, and that was the part. It's just not one aspect. It's just a continuous, you see, work. And another example is, of course, photo chopper injuries. I, being a surgeon, was in detailed discussions with Saeed that people come into hospital with photo chopper injuries, amputating from fingers even to forearms and hands, and chopped off, and you can see the process. And he managed to make the mechanics change to reduce and eliminate serious injuries like photo chopper. And look how the fodder is pushed by the hands, and it can easily be trapped in a roller taking to the cutter and crushed, and amputations they occur. And you can see the electric hazards as well, and the distance at which the switches are placed. And this is how you do it. He managed to identify the risk, each and every aspect, and then led to the change so as to reduce and mitigate the risks which were involved. And you can see the change, and you can see the photo chopper simply entering into a protection, and a conveyor belt can reduce these risks to a great extent. And another, you see, carpet weaving is a very famous work where children used to work because they are horizontally designed, and the adults cannot sit for long hours of time, and the children used to work here, and that led to not only just musculoskeletal problems and arthritis at an early age. So he did improvised work and low-cost solutions to almost eradicating child labor, but also improving ergonomics for adults as well. And you can see from a horizontal design to a vertical design, so that the adults can work, and the childs, even they just can't go to from they can't work in these areas, improving ergonomics and preventing long-term musculoskeletal sequelae, but also minimizing child labor. And this vertical design being explained to the chief minister, how it managed to improve the ergonomics, but also reduce the child labor. And these are a couple of publications indicating simple workplace interventions to reduce hazards and reduce the child labor at the same time. So brick kiln process and its impact, another avenue on the which led to problems in health of the children and young. And he studied bonded labors as well, and managed to improve the working conditions. And this is just an example of a kiln area. And you can see the soot and the pollution, which is not just limited to the kiln area. And the process of molding bricks from the mud involves bonded labor, where whole families, including children, work under obligation in scorching heat of summer. And you can see, you can all understand the problems. Even the females, they work here for long periods of time because they are bonded to work, and they stamp the molded bricks and note the position and how it can impact the musculoskeletal system. So this is the area where bricks are being stacked in the fire area of the kiln. And how they're fired. The coal prices are high. So even you see in Pakistan, cheaper but much more toxic materials are being used to fire kilns. And that includes plastic scraps, shredded rubber tires, poultry droppings, and even used lubricants. So say all toxic fumes. So brick kilns, when the bricks are removed within first 24 to 48 hours, fumes and emissions from still burning fuel inside produce lot of dusty clouds around workers. And this area where he got the maximum dust exposures, and they were recorded for a very good presentation. In 2014, I presented on behalf of the Saeed Awan in AIHC meeting at St. Louis. So bricks being loaded for the market, just a part of the process. And there's another area of services, the child working in different areas, just quickly in auto workshops, street restaurants, non-shops. And so stone crushing factories as well. I'll just go into the quickly. These stone crushing factories, a classical example of acute as well as chronic ailments, leading to respiratory failure and inability to sustain work, and ending up with obstructive airway disease in early 40s. So people stop working in 40s instead of 60s and 70s. And these are the few pictures of stone crushing factory. And the dust is pure 100% silica. And you see this graph. This is again the levels taken by the Saeed at that time. This graph shows how dangerous levels remain at different parts of the stone crushing factories. And these are the permissible levels, maximum 0.2 milligram per meter square, and recorded are up to 400 times to even maximum permissible dust. These are the dust levels, and these are the silica levels, and this is 100% pure silica. So I call it an immersive approach. So he was so immersed, so involved in whole of the process by visiting workers and families, and by involving the local community and influentials, arranging workshops, distributing leaflets, understanding hazards in depth, and coming up with solutions, and so on. He just kept on, and that is simply is very good example of empathy. That's what I think. Setting benchmarks for his team and associates, helping vulnerable beyond his professional commitments. That was the key of his success and understanding of all this. So respecting beliefs. So people believe their religions and everything, but at the same time, say used to make them understand, make the believers understand, and make them realize the religious obligations are beyond rituals. So we have to make the people understand that all religions are actually the basics of humanity, and the codes of human rights and humanity are so important, and they become the basis of every religion. So it's so important to not just understand, but to make people understand. So this is one aspect. Dua has already reflected it as already they are ready references and part of impacting knowledge and even training on the pupil. And this is just an example. He made pamphlets and in local languages, sending teams to conduct workshops at workplace and distributing these handouts for quick understanding and reference. And use of these safe use of pesticides, insecticide, even fertilizers. So you just so quickly he make the people understand that how easily they can prevent the implications of these things, highlighting ergonomics and exercises by cartoons to keep the physical fitness while doing outdoor work for a longer period of time. So use of protectives and preventing ailments, all was his efforts. And from work to education, that was the message at the end of each and every pamphlet in each and every district he used to distribute. And in an interview, actually, Saeed said, my heroes are children who are working in very difficult circumstances, supporting their families. I want these heroes to go to school, not to work at a very hazardous environment. These are very tenacious and highly intelligent people. Unfortunately, we are missing a huge potential of humanity. So in summary, a multidimensional approach is required to address all of it, and we need to improvise, act judiciously, respecting local cultures and norms, improving ergonomics, and engineering solutions. All in all, we need leaders to carry forward the legacy. And I think at the end, human perseverance, motivations, and endurance always surpass any obstacles and are not always resource dependent. Thank you so much.
Thank you, Dr. Alvi. That was an absolutely wonderful presentation. And before we get to questions, I wanted to just give a tiny bit of background. Early in 2011, when WHWB was established, Chuck Pilger and I were introduced to Saeed by Susan Gunn. And we worked with Saeed for about a year and a half on Skype. We never got to meet him in person. But he introduced us to the brick kilns, as well as bonded labor and child labor. And WHWB Brick Kiln Group grew out of this interaction with Saeed, and the work continues and has expanded today to include silica exposures in a variety of workplaces, as well as child labor, also unfortunately in a variety of workplaces. So just to explain a little bit of how WHWB is connected with Saeed, and we are so grateful for his leadership and for your presentations, Dr. Alvi and Dua, today. This is wonderful. So with that, I would like to open the floor for questions. You can put your question in the chat, or you can raise your hand by your picture if you, or just jump in.
Yeah, I got one question. Did he involve with the capacity building of OSH expertise and professions in Pakistan? That is the teamwork he did, of course. I mentioned in one of my slides, maybe I was quick, fearing not to overshoot the time period. But yes, of course. And all these pamphlets and everything I shown, that was part of the capacity building and knowledge distribution among the workers. He made a team. He was a leader. He made a team of his department, gathered everyone, explained them, went himself as a role model. It was not just asking someone to go there and get the things done. He'll go himself. One example, one morning, one evening, I still remember, he was in office, and there was a letter from one of the sectors asking to explain some chemical hazard and thing that. Instead of asking his subordinate to just write a letter to them, and he went himself there, typed the letter immediately within minutes, and just sent them. So he was so dedicated and so motivational. So that was capacity building was one of his major actually interest. That his department at that time was working almost round the clock. You see, in different segments, different sectors, from data collection to analysis, and then making the people involved. He involved engineers, he involved psychological pupils, he involved psychiatrists, and he involved doctors, health professionals, and everyone, just to come up with solutions. And I think that is the best thing. And in terms of making the things go ahead. And that was an example of capacity, great example of capacity building in low resource country. Yes.
There was a question, what is meant by bond workers?
Yeah. So bonded workers, particularly there are a few sectors in which people, in the form of family, they get some money before they enter into that particular labor. So the employers, they give money to a family, usually the head of the family, and then ask them to complete a particular task in a particular time frame. For example, making say 10,000 bricks in say 1 month. The task is usually so difficult, it's not possible to complete. And this bonded labor, they give some further incentives, and they just keep on accumulating. And that is the problem. And once they bond a family, it becomes never-ending commitment, and they just keep on working with almost no wages in a very poor environment, and whole of the family actually work to complete the task, and they just keep on working. And this is how they bond it, and they never allow them to leave their work.
There's some very good questions in the chat. I'll just mention two of them. Two people asked where they can obtain either books written by Saeed or any more literature about his projects? And another question is with respect to the ILO guidelines on child labor, how has the government of Pakistan translated these into actionable and enforceable legislation, and how can other low-income countries learn from this study?
So he was a director of the Labor Department, and all of the work even you see in a Knight Ridder Award he got some money, I think about $50,000, and he all paid it to his department for the further work. Never used it for himself. So all the work which he did was for the department CAWCE, which is now called as SACIWC, that is Saeed Awan Center of Improvement of Working Conditions and Environment. So everything is there, but we need some people to just keep on moving forward. But it is available. It is available with the department of the Saeed Awan, yes. And I think if somebody want it, I can probably try to manage for its use. And some of this work is already present with ILO as well. I'm sure Suzanne have a lot of his work at her computer, I think. And I have myself have some of its work. And unfortunately, we lost some of the work as well. I could not get into the computers of his department and get all the data. And most of the data is lying without any progress since 2014. Then that is very, very unfortunate.
There was one question: how did he manage to do respirable crystalline silica monitoring? Were there logistics to do it?
Yeah, there's very, very difficult. Yeah, it's a very good question. Yeah, because I presented the acute silicosis paper, the lessons learned from Pakistan in 2014 again on behalf of the Saeed Awan. The work was done by the Saeed Awan. And it was actually, he took the samples of respirable dust from the brick kilns and the silica by an instruments. I'm sorry, I'm not a OSH expert, but I know that these respirable dusts are taken, and then he took it to the Punjab University for X-ray diffraction studies. I know because I did few of these studies as well at that time in 2014 to complete a few of the leftover work. And it needs probably heating it to a very high temperatures, and that was not available. That was taken to another university where they are heated so as to destroy everything but the silica, and then silica is taken to Punjab University where X-ray diffraction studies were taken. So that gives an actual measurable element. That's what that was how it was done actually.
Thanks.
You wanted to respond to the question about the ILO guidelines, how the government of Pakistan have they been able to translate these into enforceable actions, and can other low-income countries learn from this experience?
Yeah, Nisha, I think they can. The one important thing is that it is the person who just keep on pulling and pushing the patients to get the things done. So at the time of Saeed, he used to, as Dua said, actually, he used to go to the departments, to go to the secretaries, go to the higher authorities, making them understand what's going on, how we can improve it, and get the available funds, and involve the community and the influentials and so on and so forth. That's how he managed to make whatever he could do. Even in a lower resources, he could manage so many things. Government of Pakistan, again, I think I was studying into that. You need the people who can motivate, who can push them, and without that, there is hardly any movement. You see, the government has its own, objectives and the resources, and again, government is moved when they see if somebody is there to move on. So unfortunately, there is a huge pause after 2014 in Pakistan in terms of Labor Department, and things are almost static.
I just wanted to mention I'm allowing unmuting. If anybody wants to unmute and ask a question directly, or raise your hand first, that would be great. There are a few questions in the chat related to employers and how employers reacted to Saeed Awan's work or that kind of work, including what about when they think it's too expensive to implement occupational health and safety measures. How did the employers react, and was there a lot of resistance to what he was doing?
This is again a very good question. So there was, when I go to the department still now, after say 9 years, I find people of his department who used to say that Saeed was such a motivator that we were never tired working with him. So he was such a motivator that he used to ask the people, okay, I'll go first. Let's move this. Let's do this. Let's move on. Bring the friends. Ask the friends to ask someone, some engineer or some doctor or even me. I was his cousin. Like, but any problem relating to surgical field like photochopper, for instance, he used to ask me, and it's free. So you ask the people to come up with solutions, get the motivation, and at the end, the objective was to help the poor people. And whenever you say someone, it is the humanity we are working in, the people usually come on and they work without any, and it is not resource dependent at the same time. It is not expensive. You have to have a will, and that was the key of my presentation as well. If you have a will and motivation, resources becomes a secondary objective. Of course, they do need, but there are so many engineering solutions it came up with, like for instance, carpet weaving, photochopper, and so many things. It doesn't need much resources. It is not expensive at all. So I think motivation and will is not expensive.
So feel free to jump in and ask questions. But if you want to raise your hand, if you go down to the bottom, there's sort of a smiley face and it says reactions. And if you click on that, there's an option to do raise hand. So don't be afraid to ask. Such excellent presentations.
Yeah, I see the question from Alec about, and I don't know, Alec, do you want to just step in and ask your own question?
You need to unmute.
Sure, I'll ask, and I'll start my video. My internet's not that great, so I've turned off my video. What a wonderful session. I want to thank the family. I've learned so much. My question was really about the environment with the employers, whether there were any employers who actually supported the direction that was being taken, who were more progressive and realized that there was a business case for it. Were there any progressive employers that were on side with at least some of what was being done?
Yeah, it's very unfortunate to say, honestly, there is hardly any progress, to be very honest. I have been to his department many times to see. Actually, our system runs in that department is headed by someone, and there are so many workers under him, and they have to obey what the boss says. And if the boss is not motivated and is not willing to work, or he's not a true occupational safety and health person, and it happens sometimes in low resource countries where you lack people with capacity, or you lack people who are trained in OSH. Unfortunately, the department is headed by someone who is not OSH too. He's an engineer, and sometimes you have people who don't know how to go about it. And that is the reason I just mentioned that it is almost static from there. It was a huge, you see, from 1988 to 2014, or towards the end of 30, there was a huge work. And so much so that at that time I learned that CIWC is probably progressing towards making a state-of-the-art center in Southeast Asia. I'm sure Suzanne knows it. But I think that center was later taken by India. So the reason was the people were just static. There was no progress. So it's very sad to say that.
Oh, there's a very interesting question by Hang Hao Chang. I'm sorry if I said your name wrong, but would you like to ask your own question here?
Yeah, of course. But I think my question was answered previously. I'm just wondering, a lot of employers will claim that if you want the employers to invest more in occupational safety and health, they would rather to close the factory and workers will lose their jobs eventually. So how do you deal with this dilemma of occupational safety and health and employment at the developing countries?
Yeah, I would like some OSH person to answer this question. Yeah, but generally, I think coming back to my aspect, you see 80% of the workers in Pakistan, they work in informal sector. They are unregistered. And if nobody knows, difficult to assess areas that how many of them are actually working or out of work. If a factory stops, or there are two areas in Pakistan. One is social security. Social security gives some compensation, but only if there is health-related issues. But otherwise, no security actually exists in Pakistan. And for the first time, I'll mention the last premier, Imran Khan, who started SAS program. And that was a wonderful program. I, being non-OSH, being a doctor, I know that program was a wonder in addressing and reaching out to the people, as Mr. Hang is saying, that who are out of work, or the factory is closed, or the factory has some disaster and problems. And they used to not just help them out, but also make easier for them to work in other factories or find work in other factories as well. So a SaaS program, unfortunately, has been closed by this regime. I will not go into the political details, but you see, this is one of the examples, okay, how an extraordinary leadership make the changes so quickly. So, but unfortunately, and how quickly when the systems are not developed in any country like Pakistan. So it is the strong personalities work for, and once they're out of the profession or job, everything is collapsed. And this is what happens actually.
Thank you. I see that Sashikala has a question in the chat. Sashikala, are you willing to unmute and ask your question directly?
Yeah, hello. I just wanted to know your suggestions on OSH frameworks for migrant workers particularly.
Migrant workers, sorry?
Yeah, occupational safety health measures frameworks for migrant workers.
I'm sorry, I don't know the answer to this question. You see, I should have mentioned it. I'm a doctor. I'm a health professional. Not an OSH expert. I was here just being close to the Saeed and some of his work, but I don't know the details of departments and their work and their policies. I'm sorry for that. I don't know this answer.
Okay, thank you, sir. Thank you.
Susan, it looks like you're raising your hand. Go ahead. Susan, did you want to say something? Can't hear you. Okay.
Susan, did you have a comment or question? You're not muted. Susan?
She's trying to talk through her phone, maybe.
So I hope you, both Dr. Alvi and Dua, you're seeing the thank yous in the chat. because there are many thank yous in the chat. So please do read them. Certainly a lot of appreciation for this lecture. I also posted some information in the chat about donations to Workplace Health Without Borders. We are an all-volunteer organization, and we survive on donations, which allow us to keep some administrative work going and offer our training programs and webinars. So there's information about that in the chat, as well as about certificates of attendance. So just wanted to mention that before we lose too many people. Please do look for that information in the chat. And I see Tuan, you're raising your hand. Go ahead.
Yes, can you hear me okay?
Yeah, yes.
Yeah. This question for Dua. Are you planning to become an occupational medical doctor?
Well, not
This would be
right.
great to carry out your father's work.
Yeah, I mean, I have thought about it. Of course, I've thought about it, but still figuring things out, like what to do. Like last year of med school going on, and I'm still figuring things out. But I think I might end up going into OSH after all, an occupational health worker. That might happen.
That would be wonderful.
That would be fantastic.
You'd be welcome. Yes.
We're here to support you.
Yeah, I would love to do that, honestly.
Super.
And I see that there were some, sorry to interrupt, but there were some people there was a person that was interested. I won't call him or her out, but that were interested in becoming an occupational health and safety person. And meaning they are closely related, but they don't have their background in this area. So please contact us through the WHWB.org website, and we'll let you know about the training that we have and discuss pathways more thoroughly with you. We welcome that.
Thank
so
you
I
so
think
much.
got the audio back.
Just quickly, one thing from this question, the last question to Dua. The Saeed was planning to have a center where he can make, again, it's also related to the capacity building. You see, I went to the department in 2004-05, I think, for the first time, and I saw a beautiful auditorium in place. I'm sure Suzanne has seen that. A beautiful auditorium and adjacent areas where he was planning to make things to train the people, to make workshops, and to start a mini fellowship to start with in OSH, and later on develop in a better center of excellence. Unfortunately, all gone. So it is in the context of the previous question, just to mention.
Thank you.
Okay, do we have a mic now?
Yes.
Okay, I would like to make 2 or 3 points. One is that they've been such excellent questions that I think the team that organized this lecture might work together to put together some answers, as well as the publications and documents that Saeed produced. Now, we'll ask Marianne and Jennifer's permission, perhaps, and whether we could put this up on the web, the WHWB web, the answers to the questions and the publications of Saeed Awan. Is that possible?
Yeah.
And I'm saving the chat, so I'm saving the questions.
Mm-hmm. Yes, we can do a post on the website.
Yes. The second thing I wanted to raise is that friends who are on the video, if you know of somebody like Saeed Awan, either living or who has passed away, who you feel fits this profile, somebody who has made maybe extraordinary contributions to the field of occupational safety and health, but under difficult circumstances, shall we say. Maybe he's not somebody who's famous. Maybe it's somebody who's just been working hard and has been able to really achieve something for local workers. send us the names. Send us the name and maybe a paragraph about that person. Okay, because we hope that this series will go on as an annual lecture series every year. I want to say just one final thing about Saeed's contribution that many people don't know. Even when he was ill with hepatitis, he worked with Afghanistan in order to develop a list of hazardous work. So he was working at the international policy level as a result of these efforts, which were described by Dua and Dr. Alvi at the local level. So even though maybe the center isn't as active now as it should be, it's still his legacy is being carried on at other levels and in other countries. Thank you.
Thank you.
Thank you very much.
Thanks.
You.
Yeah, thank you very much.
Just quickly. So his Afghanistan work was a wonderful work. I have a few of the copies. And you see, one of the slide which I showed was the religious, you see, believers, how he managed to make them understand it is not just rituals, it is the codes of life on which every religion is based on. It is to be human first. So, and he used that actually in Afghanistan. There was a full paper, you see, on the using a religion because they're strong believers. So I think being a human, we have to respect each and every, and by respecting that, we just can make the things better, easier for the working for everyone. So it is you just have to make them understand what are their rights without pushing what I want to. I think that is the important thing. For me, it is so important. I don't want to push my culture into anyone's or anyone else, but I want to push one thing: be human, be empathetic, be safe, and be rightful.